Hello everyone, so I'm Dr. RMD and we'll be having a final series for INICET where we'll be discussing high yield important topics for INICET only and repeated recall mistakes that you make actually because of this INICET last minute errors, because what actually determines your rank in INICET and neetpg is the last minute preparation and how many things you remember, your recall, rather than how much you have studied so far. Okay, so I'll be solving certain MCQs and with that I'll be telling you tricks to remember these things so that you won't forget them during your INICET and upcoming neetpg. Okay, so your first question is 3-year-old child. So these are basically mixed bag of questions, so we'll be going through important things only. So this is basically developmental milestone, and in this question it's asked based on normal developmental milestone, which of the following social skills is the child expected to demonstrate. So at 3 years, what are the developmental milestones that a child should have? So we'll go to pediatrics. Okay, so I'll just type in here pediatric mnemonics. Yes, this is orthopedics. Okay, pediatric mnemonics. Yes. So basically this is the developmental milestone mnemonic, and here if you observe at 3 years of age, okay, so this is 3 years. So at 3 years of age, patient will be riding, the baby will be riding tricycle, that is 343, will be knowing age, gender. Okay, age and gender will be known. See here, 3 years, where is it? Yes, 3 years, 3 things, that is name, gender and shares toy. So 3 things, that is name, gender and shares toy. This is the social developmental milestone. Okay, and does 3 blocks, okay, 3 into 3, and knows 3 facts, and parallel play is there. Okay, that is 3L, parallel play. So these things come at 3 years. So here among the 4 options, the correct answer is he knows his name, full name, gender, and will share ball game also. So the correct answer is knows his full name and gender. Next question is, during well baby clinic, mother asks about a 6-month-old infant what he should be making. So basically, what is a language milestone at 6 months? So this is the language milestone which we have mnemonic for this. So 1 month, alert to sounds. 2 months, there are 2 O's in coo. So 2 months it is cooing. 4 months it is 4 letters, that is ha ha, like that. Okay, just it is called as vocalization. Okay, this is called vocalization. At 6 months, unisyllables like ma, ba. So 6 means single syllable. 9 means mama, papa, baba, all this. Okay, so this is at 9 months. Okay, at 12 months, the child will have 1 to 2 words. So 12 months means 1 to 2 words. And at 18 months, 8 to 10. You can say 8. Okay, 8 to 10 word vocabulary. At 2 years, 2 to 3 word sentences. Okay, so 1 to 2 words was at 12 months. At 2 to 3 years, it will be 2 to 3 sentences. Okay, next at 4 years, 4 lines song poem, and at 3 years, child will ask many questions. Okay, this is also coming under milestones. Okay, that is social developmental milestones. So the correct answer over here will be speaking. At 6 months, there will be monosyllables like ma, ba, pa. Okay, so monosyllables. So single for 6. Okay, that is how you remember. Next, toddler is playing building a tower of 9 blocks. So for this tower, there is a mnemonic. It is over here. See, so you should just multiply it by 3. Okay, so at 1.5 years, so just take it as 1 year into 3 is 3 blocks. 2 years into 3 is 6 blocks. 3 years into 3 is 9 blocks. At 4 years, 4-lane bridge, and at 5 years, 5-bar gate. Okay, this is how you remember blocks. So at 3 years, how much it will be? 9 blocks. Okay, so the answer is 3 years. Okay, next, what is the recommendation of iron and folic acid? So for this also there is a mnemonic. What is the mnemonic? The mnemonic is 246. Okay, 246 means at 2 that is less than 2 years and less than 2 years, will be giving 20 mg of iron and 100 micrograms. Okay, at 4 years and above that, okay, that is more than or equal, more than 3 years, basically we are giving in terms of 4, that is 45 mg and 400 microgram. And above 10 years, we will be giving like adult dose, that is 6 mnemonic, that is 60 and 500 microgram. Okay, just remember for iron, then folic acid becomes easy. Okay, folic acid it is 100, 400 and 500. Okay, so basically we will be giving in our question it is 8 years. So 8 years means it is rule of 4. So it is 45 mg iron and 400 microgram. So how many times? See here, for babies less than 5 years, it is bi-weekly. So B for B, baby is bi-weekly. For everyone else, it is weekly tablet. Okay, in pregnancy only we are giving red tablet, otherwise it is weekly tablet. Okay, pregnancy will be giving daily. Okay, so the answer is 45 mg plus 400 mg folic acid, okay, weekly. Okay, because it is 8-year-old. If it was a baby, then it is bi-weekly. Okay, up to 5 years. Next question is based on congenital adrenal hyperplasia. So you can see over here there is a mnemonic, that is there are 3 enzyme deficiencies. You know that there is 21 hydroxylase, there is 17 hydroxylase, and there is 11 beta hydroxylase. So it's very easy to remember. Whichever starts with 1, okay, that is 17 and 11, they have salt retention. So there is increased blood pressure. Whichever ends with 1, that is 21 and 11, they have viralization. So just remember this table like that, okay. So in this question, there is severe salt retention. So there is hypertension and there is ambiguous genitalia also. So there is something which starts with 1 and ends with 1. So the answer is 11 beta hydroxylase. So next question is regarding pelvic development, the pelvic organ, the reproductive tract development. So under OBG, we have this development of Wolffian and Mullerian duct. Okay, so Wolffian is mesonephric and Mullerian is paramesonephric. So the question here is from the mesonephric duct, which is the remnant that leads to cystic structure in the lateral wall of vagina. So basically, what is the remnant of mesonephric duct in females? Okay, so in females, we know mesonephric duct. What is the remnant? See over here it is given. Female remnant of mesonephric duct is, what is this? Wolves belong outside the garden. So basically it is outside in the garden. Remember this image. So wolf is always in the garden. That means mesonephric duct, other name is what? It is Wolffian duct. Mesonephric duct, Wolffian duct. Now how to remember Wolffian duct is mesonephric duct? Just we'll make it reverse, okay? W is M, okay? So W means M. So Wolffian means mesonephric duct, and mesonephric duct is present in males basically, okay? In females, this Wolffian and mesonephric duct, this remnant is actually wolves belong in the garden mnemonic, that is Gartner's duct. So the answer is Gartner's duct. Next, 24-year primigravida 8 weeks gestation is diagnosed with thyrotoxicosis. So which antithyroid medication? So basically they are asking in pregnancy in first trimester which medication to give. There are 2. You know there is propylthiouracil and methimazole, and always in exam you will get confused between these 2. So what is the mnemonic for that? See over here. In hyperthyroidism, in first trimester, remember as 1. Okay, so propylthiouracil, you know. PTU means you know, uni. Okay, uni means what? 1. So that means in first trimester it is PTU, and in second and third trimester it is majority. M for majority, M means middle, that is second and third trimester. So it is methimazole. So the answer for first trimester is propylthiouracil. Next, couple presents for infertility evaluation for semen analysis, and this is one of the very frequent questions where students go wrong. So we'll go for semen analysis, how to remember mnemonics. Okay, where is semen analysis? Over here, yes. So it's easy to remember. How to remember volume? Valentine's Day is on February 14. So volume is 1.4 ml average. Okay, remember like that. Morphology, how much it should be there? 4%. 4% should be morphologically normal. Okay, so we have 4 limbs. So normal morphology is 4 limbs. Okay. Next, what is the concentration? 16. How do you remember? At your age of 16 years, that is when you are preparing for a class 11th and 12th, you are very sharp. Your concentration in studies for maximum. So 16 million is the concentration of sperms. Next, what is the motility? Your career progression is maximum when you are towards your age of 30. So your progress is maximum at 30. So for progressive motility is 30%. Next, what is the total count? 39. How to remember? Total count. What is the total duration of pregnancy? 39 weeks. So how you remember? 39 million. Okay. Now, what is the total motility? Remember, motility means running, that is marathon. And how much is the motility? Total marathon distance is 42 kilometers. Okay. So that is 42%. And what is the viability? How much should be minimum viability? 54. At 54, many people die. Okay. But still at 54, you are still viable. Okay. So it is 54. So what is our question here? Which of the following represents the lowest reference range limit for normal sperm morphology? So morphology means what? 4 limbs. 4 limbs means it is 4%. So answer is 4%. See now how easy it is to remember. Yes, next. Woman complains of vaginal bulge that worsens with straining. So anterior vaginal wall prolapse is present, that is cystocele. So what are the D-Lancey support systems that are available? So basically uterine supports. Okay. So do we have mnemonic for that? Yes, we have mnemonic for vaginal supports. Okay, D-Lancey's classification. So here you will see level 1, level 2, level 3 are there. Level 1 means it is CU ligaments. Okay, remember it as CU, that is level 1. Level 2 is L, okay, that is lateral attachments. Okay, everything is in L. And level 3 is the PUG system. Okay, that is PUG. Okay, remember like this. Remember the dog, level 3. Okay, so first is CU, second is all lateral, and third is this PUG mnemonic. Okay, so Here it is asked cystocele is there, okay, anterior vaginal wall prolapse is there along with cystocele. So remember here lateral wall, no, there is levator ani and two seals can form in this. One is cystocele, another is rectocele. So the answer will be level 2 over here, okay. Next, newborn infant is diagnosed with Epstein anomaly. So which of the following pregnancy drug is related with this? So basically they are asking teratogenic mnemonic, okay, which are the teratogenic drugs. So how will you remember Epstein's? See here, Epstein is what Epstein anomaly is, where there is if there is the 4 chambers of the heart, the tricuspid valve is present at the lower end, okay. It is not here, it is over here, it is present lower, okay. So low insertion of tricuspid valve is Li, low insertion. So low insertion is nothing but lithium. So the answer is lithium. Yes. So this is how you go ahead. These are the other teratogenic drugs that are available. So you can just remember this with mnemonics, the main ones. Okay. So these are the OBG mnemonics that are present. Okay. And you also have pediatric mnemonics over here. Okay. So in pediatric, the most important one is developmental milestones, and you should definitely go through this mnemonic. So in part 2, we'll be discussing other subjects as well.